And joining me now is Dr. Elliot Frank. He's an infectious disease specialist here at Jersey Shore Medical Center in Neptune, New Jersey, not too far from one of the epicenters of these measles outbreaks in Lakewood, New Jersey. And Doctor, it amazes me that as I look into these incidences popping up here and there all around the country, it seems to all be centered, mainly at least centered, in the Orthodox Jewish community.
Well, certainly the recent outbreaks have been centered in the Orthodox Jewish community. I think that one should be aware that there are clusters of cases in 15 states in the last year or two, and there was a significant outbreak in California that did not involve the Jewish community a couple of years ago in California. But I think there's a confluence of factors that make the Orthodox Jewish community perhaps ripe for this. In every community, there are those who seem to subscribe to sort of an anti-science. They subscribe to the notion that they're being led astray by all of the medical professionals in the community, all of whom have come to the conclusion that the risk-benefit ratio for vaccines is amazingly good, that the likelihood of an adverse event from a vaccine is amazingly low, and the potential benefit is astronomical. Let's put that in perspective for measles. Before measles vaccine came on the scene and was regularly used, there were 3 to 4 million cases of measles in the United States every year. There were 450,000 hospitalizations. There were 5,000, mostly children, who ended up with chronic disabilities from measles encephalitis, inflammation of the brain related to measles. And there were 400 to 500 deaths per year from measles. And we essentially wiped out that disease with the advent of the vaccine. And we were doing well for many, many years. And only in the last decade or so have these pockets of anti-vaccine proponents popped up, which have led to significant outbreaks. One needs to understand that not everyone needs to be vaccinated, but if you have 95% of the population, 98% of the population vaccinated, there's a concept of herd immunity in which those who are not vaccinated are protected because the disease prevalence is so low that those who are not vaccinated don't have anyone to catch it from. But when the anti-vaccine population grows to a critical mass, to say 10% of the population or 15% of the population, then you start to have resurgence of an otherwise entirely preventable disease. And the Orthodox community may be a little bit more ripe for this because of the density of the population, and perhaps to some extent that some elements of that population are not as readily accessible in terms of common scientific knowledge. They don't go on the internet a lot, or if they do go on the internet, they go into very restricted areas. So they're not getting the full story, and they're led astray by the anti-vaccine elements. It should be emphasized that these elements are a very tiny percentage of the community, of any community, and particularly in the Orthodox community. The vast majority of the Orthodox community strongly advocates in favor of vaccine, and in all of these communities, the vast, vast majority of rabbis have come out with clear statements that it is not only appropriate to vaccinate, but it is incumbent, according to Jewish law, that people vaccinate their children.
Are there actually, though, some religious leaders, some rabbis who are telling people don't vaccinate based on religious belief?
I know there are no religious leaders that I'm aware of that are saying that people should not vaccinate for religious reasons, but there are those who listen to inappropriate medical advice and think that they're giving their followers good advice, good medical advice, in telling them not to vaccinate. And if they believe that the risks of the vaccine are greater than the benefits, then the Jewish law would say don't vaccinate. But it is incumbent on all the rabbis to listen to the leading authorities, and the leading authorities clearly say that the vaccines far, far the benefits of the vaccines far, far outweigh any negative effects.
So as you point out, this anti-vax movement is not limited to the Orthodox Jewish community, and it could affect people anywhere in any community. And we see pockets of this popping up all over the country. My job is to, at night, try to cull stories from every state of the union, and I see incidents, of course anecdotal, but I see incidents of communities where this is a real problem. Are the public health officials attacking this problem aggressively enough?
I think they're doing what they can. I hate to say it, but part of the problem is the internet. And patients go online and they get information, and they have no way of really vetting the source of that information. So they see the information from the public health authorities, and they see what looks like credible information coming from other sources, and they have to weigh for themselves which one to believe. And sometimes that's not so easy. And if you couple that with some distrust of the establishment in some pockets of the community, some ideas that I will be protected by everyone else getting vaccinated, so why should I take even the smallest risk from my child? Hopefully that notion is going to fade quickly as we see people getting sick now because of this anti-vaccine movement.
And of course, children, they're not candidates for the vaccine until a certain age, so they're susceptible.
Right, so we can't vaccinate children under 6 months of age, so they are always going to be vulnerable. Patients with immune compromise, so children who have something wrong with their immune system, because this is a live virus vaccine, they cannot be immunized. So what the anti-vacciners are doing is not only putting their own children at risk, but they are putting at risk the most vulnerable members of our society, the babies and those children who have immune defects. And in Israel, there have been 2 deaths related to this measles outbreak, and I would venture to say that at some point, if this continues, we will see deaths related to measles in our communities.
Now, I've been vaccinated, and I guess most people of my generation have been vaccinated, and I'm walking around believing I'm immune to this problem. But I just read a story yesterday about a flight attendant on an LL flight from JFK to Tel Aviv, who, from one of the passengers presumably, contracted the measles, is now on life support. And this is an individual, I don't know if it's a male or a female, they haven't identified the patient, of course, who they say was vaccinated.
Right. So this vaccine is highly effective. To put it in perspective, the influenza vaccine perhaps is 40 or 50% effective. The measles vaccine, if one is to get 2 doses of the vaccine after age 1, there is a 99% antibody response. So you'll be 99% protected. However, 99% isn't 100%. So there are those who may fall through the cracks. And they are perfectly safe when the vast majority of people are immunized. It's only in these kinds of instances when pockets of individuals refuse to be vaccinated and therefore can spread the disease that even individuals who have been vaccinated may be vulnerable. But I would emphasize that the protection is extremely good. And anybody born before 1957 and anyone who received 2 doses of the vaccine after age 1 really does not have anything to worry about. And I think that Israeli flight attendant is probably the exception that proves the rule.
So the bottom line to all this is, if you have been hesitating to vaccinate your children, you should go right now and have your child vaccinated.
Absolutely. Now more than ever, it is imperative that people make sure that their children are up to date with their vaccines. Measles in particular is extremely contagious, and that's why this spreads so quickly.
Dr. Elliot Frank at the Jersey Shore Medical Center, Neptune, New Jersey, infectious disease specialist. Thanks for joining us. And folks, please feel free to subscribe if you like this, so you'll be advised if you hit the little alarm bell of future interviews. And thanks again.
Thank you, Gary.